Mark Scar on KIOW. It's House Calls with Hancock County Health System, bringing health care to you. Your health, our care, a lasting partnership. Our topic for March is colon cancer, and we're being joined by Dr. Jerry Nelson. Jerry, good morning. Thank you for joining us.
Thank you very much. It's a pleasure to be here.
I know Hancock County Health System has been creating awareness about colon cancer all month. Can you tell me a little bit about this disease?
I'd love to. Colon cancer is the second most common cause of death from cancer in the United States. And it's responsible for over 50,000 deaths in America a year. The thing that makes this so scary is that early preventable stages usually don't produce any symptoms. And even as it progresses to early cancer, the most common sign is just a small amount of blood in the stool.
So if there are no symptoms, doctor, what are your recommendations on reducing our risk for colon cancer?
That's a good question. We always try to find something that doesn't involve, more pills. The most colon cancer really occurs due to lifestyle and to increasing age, with only a small minority of cases that are associated with underlying genetic disorders. So the best prevention, and what I recommend to my patients, is a healthy diet centered around fruits and vegetables, and a colonoscopy screening when age and risk appropriate.
Of course, doctor, you always hear from people that have colonoscopies and go through that process. It's not the most pleasant thing in the world, and people don't look forward to it, but maybe we can allay some of those fears and talk about the procedure.
Sure, I'd love to. In order to see, colon cancer comes from small polyps in the colon. And so in order to see those small polyps that grow into the colon cancer, a patient's colon needs to be clear of all the waste and the food material that's in there. So in the past, patients have been given this gallon of Go Lightly. I hear these horror stories about this gallon of liquid that they've had to drink, and along with a laxative. And it was very good at cleaning out the colon. Since a lot of patients complained about the volume and the taste, many surgeons have switched to a combination of Ducalox tablets and a half gallon of Gatorade mixed with Miralax. This tastes a lot better, the volume is less, and it still produces an excellent clean out so that none of the small polyps are missed during this procedure.
Doctor, any final thoughts about colon cancer that you'd like to share with our listeners?
Sure. Things that increase your risk for colon cancer are just getting older, male gender, a high-fat diet, alcohol or red meat, obesity, smoking, and lack of physical exercise. Making changes in your lifestyle and scheduling a screening colonoscopy at age 50, unless there's a family history of colon cancer, can reduce your risk, because you can survive colon cancer if it's detected early. If listeners would like more health information, I invite them to our website at www.trusthchs.com. Our healthy living tools on the website include a symptom navigator, health risk assessments, and drug interaction database to help you out with your medications.
Doctor, thank you so much for your time and all this pertinent information. We appreciate it.
Thank you so much for having me.
And that's Jerry Nelson, doctor, providing treatment and care for the whole family at Garner Medical Clinic. And this has been House Calls with Hancock County Health System, bringing health care to you. Your health, our care, a lasting partnership. On behalf of Dr. Jerry Nelson, I'm Mark Scar on KIOW.